This procedure which you are watching now is called site making or slitting. We call it, scientific word is slitting. Slit mean one micro cut. So if my producer can show you, I'm putting this cut in between the existing hair. So what you need to do is, I will tell you about the size of the cut, but now you see I'm doing these slits in between the existing grafts. And hair follicle, even it is micro, it is full terminal hair, it is growing hair, it is vellus hair, pseudo vellus hair, means thinning out hair. Everyone is very much precious and you need to save it. So while doing slits in the existing hair, you need to do two things. One is make a slit for the new hair to be transplanted in that area, and other thing is you need to take care of the existing hair. You cannot simply cut the existing hair. Some people, they would say you that there is no importance of taking care of the existing hair, then why we are talking about the shock losses. And if you do this activity, you cut down the existing hair, what would happen if there is partial transection, partial wastage or full wastage? What would happen? That follicle which is traumatized, which is cut partially or in any way, it will go into the resting phase in a second. And keep in mind, 10% of the temporary losses going into the resting phase can be converted into permanent losses. So we need to take care of each and every follicle, because to us, each and every follicle is very much precious. We will take care of each hair. If you are a competent doctor, you want to be competent doctor, for your patient, you need to take care of each and every follicle, okay? This is very important. Other thing is size of the graft. If I can show you the slitting, it is at acute angle. I'm doing it like it is angled micro knife. You cannot even see with the naked eye. This is very micro knife and it is angled one. And when we do slit, it is at the acute angle, dropped in frontal side, okay? Other one is size of the slit. Size of the slit is just according to the size of the graft. So once I'm doing slitting, I'm taking care of the depth of the slit, size of the slit to get the new follicle fit in. And other one is I'm taking care of each and every existing hair in this area. I'm saving them, and in my office, you will never see a single hair follicle wasted in slitting, in placing, in excision of the graft from the donor area, and even in the storage process. So this is the whole story behind the success. Once scientifically we say that we are taking autologous grafting, we are taking own grafts from own donor area and putting in the same recipient area of same person, then science says that if you are taking care of these 4 or 5 things, you can grow all of them. If not wasted, it taken safely, stored safely, placed safely, they will come out. And I hate to see the failure rate even 2% or 5%. But scientifically, science says that if 90% of the grafts, they grow up, this is very good growth rate. But I don't want to see a single graft to be wasted. That's why I was insisting you to show to the doctors that once you are producing slits, this is the job of the doctor. It should not be done by the assistants at all, because they will not take care of the existing hair. They are not having sufficient knowledge to deal with the recipient area, how to make grafts, what would be the size of the blade chosen for that particular patient, because every blade cannot work for every patient. Every patient is having hair of different caliber, different size, different thickness, so it cannot work for every patient. So you need to choose the blade according to the size of the hair follicle for that particular patient, okay? And that is very important. And doctor actually, who they are, hair transplant surgeons, they are knowledged, they have a sufficient knowledge to deal with these things because they are actually taught for that. And that's why I keep on insisting that once you are choosing your doctor, you should be looking for at least the doctor certified by American Board of Hair Restoration Surgery or members of International Society of Hair Restoration Surgery. So those doctors are at least monitored, they are watched out, and somebody is watching them 24/7, okay? So they are accountable to the big organizations. If they do something like, they will be questioned, and if they say something wrong, they will be questioned. So once you are choosing the good doctor for yourself, you should be looking for at least American board certified diplomats around the world. And now American board is the only qualification for hair surgeons which give them high standard hair education, okay? Thank you very much.